Welcome to Medico Memoirs, the podcast where we discover the fascinating facts of healthcare and explore the amazing journeys of healthcare professionals. I am your host, Jabirul, a medical student passionate about connecting you with the medical world. In each episode, we sit down with incredible individuals who bring a unique blend of expertise, passion, and empathy to the world of medicine. Together, we navigate the intricate connections between science and humanity, uncovering the unsung stories that make healthcare full of experiences worth sharing. And now, let's dive into today's episode. Our special guest today is a true maestro in the field of healthcare. She is not just only a microbiologist and a pediatrician, but also a ballet enthusiast. Please welcome the extraordinary and super energetic Bela Nishnyanidze. Welcome to the show, Bela Ma'am. The reason I call you Bela Ma'am is because for those who do not know, you are also my teacher and also a MD licensed pediatrician and also an amazing ballet performer. So, hello, Bela Ma'am. Welcome to the episode of Medic Mama.
Thank you so much for having me here. Thank you for inviting me. It is a pleasure to be here, and I wish you all the great success in this area also, as well as in your medical practice, because I know you are going to be very successful in that area. So thank you for having me here again.
Yes. Thank you so much for this opportunity that you have come on the show on the first episode itself. So, it's a very amazing thing for me to have you. So, you are also yes, you are a pediatrician, right? But since the very first day of class, I have always thought that you have so much and so many qualities and so much knowledge about the medical field. So how did you decide that you want to pursue the future in pediatrician? How did you decide to become a pediatrician?
Okay, so first of all, when I was a child, I was really interested in biology and in science generally. And this kind of led me to the field of medicine. And then when I became a medical student, uh, and I had all these options, I never wanted to become anything else than pediatrician because I want from the beginning children to be my patients because children are amazing. They are also difficult. You know, it's a level of difficulty that you have to deal with a child that cannot talk to you, that cannot express what they're feeling, what their clinical presentation is, what they feel, where they feel pain, where they feel, what, generally they cannot describe their symptoms correctly or nicely that we want them to. And it's kind of like a riddle to solve. And also, children are an amazing patient. Even though they cry a lot, still they are very lovely. They are also very loving. And I also always wanted to them to be my patient. So that's how I kind of pursued pediatrics.
I understand. Yes,
How I decided.
I agree with the thing that you said that children are very, you know, they're very problematic to guess what's happening in them. And I still remember, in one of our classes, you told us that if a baby has recently had honey, especially in Georgia, and if it has certain symptoms of paralysis or something, it is always that honey has an organism called Clostridium botulinum.
That is true, although this disorder is not very common. It's quite a rare disorder because usually parents are not Um, they usually are careful and do not give the honey in children less than 1 year of age, like in infancy. And This kind of patients, fortunately, are rare, but there is a potential threat to that because apparently, as the studies show, around 12% of all the honey in the world can contain the Clostridium botulinum spores, and there is a potential threat to that infant botulism could be caused by honey. So it's not advised to give uh, honey to the babies, especially less than 1 year of age.
Absolutely. That gives us a very clear understanding about the entire pathology as well. And also, since the beginning of our medical journey, we have always thought about microbiology and immunology. So, is there any reason you chose microbiology and immunology?
Um, I have taught some other things as well. You might not know, but I have taught pharmacology and also histology. But I kind of maintain this microbiology and immunology, and I love doing cases with the students. I love uh, giving the students the perspective that these subjects are crucially important. Sometimes when the students are starting to study the basic subject, they do not realize how much the microbiology, for example, is important, how much importance it has in medicine. And then when you get into the medical field, when you get into an actual practice of medicine, you realize that so many percent, a vast majority of the patients that you have are going to come to you with infectious diseases. And with those infectious diseases, these two subjects, like microbiology and immunology, are the crucial basics that you must have. It's a must have knowledge that a doctor should be equipped with to deal with these infectious diseases. To know about the patient's immune system, how it works, um, to stimulate it when necessary, to not overstimulate it, to decrease it when it's necessary, and also to know about the microbial agents that infect us and to treat them properly. As nowadays we have, for example, lots of unnecessary antibiotic usage um, and treatment with antibiotics, like treatment of viral infections with antibiotics, which is in itself wrong. So you have to have an extensive and thorough knowledge about this topic to avoid unnecessary treatment and also treat when it's appropriate.
Absolutely. Finding the perfect balance is very much essential to treat it properly and not overstimulate or understimulate the entire system. Uh,
I agree. Yes.
yes. I'm just curious. Have you ever had any strange case in your practice as a pediatrician, or maybe the most weird, or maybe the most interesting one?
Yeah, when you are in the pediatrics, there are lots of weird cases. There are strange and interesting cases too, and there are also very weird plus funny cases. If we say they're strange and interesting, there was a child, a 15-year-old guy who came with the paralysis of facial nerves, and then some other nerves were also affected. And eventually, he started to have a seizure, and he then progressed into coma. We had a lot of possible diagnoses. And this case was as much as interesting as it was very difficult and also unsolved. So it still stays as a mystery for us. Well, it became unsolved because the parents did not let the doctors to do the biopsy of the brain because MRI showed the case of meningitis, but the cerebrospinal fluid was not showing any signs of bacterial meningitis. It had to be a viral meningitis if it was acute, but it was lasting for more than 20 days already. So basically, it couldn't have been viral meningitis lasting for about a month. So probably it could have been a fungal meningitis as well, but uh, culture did not show anything. It was also negative. Several tests for tuberculosis, for TB was also negative. And we could not finally set the diagnosis, even though we were discussing several possible diagnoses. Um, Final diagnosis should have been made through biopsy, which was not confirmed by the parents, and they decided to take their son to another country. Unfortunately, with Georgia, that sometimes happens because um, we are sometimes not equipped with uh, all the diagnostic materials, all the diagnostic tests. Also, some treatment options are limited for some students, for some young people, and also elderly people. Um, but unfortunately, they could not solve this case either. So this case stayed a mystery with a very bad outcome, unfortunately. But we also had a fortunate outcome. A similar your guy uh, who had suddenly, after the rugby game, he that he was suddenly paralyzed. His lower extremities were paralyzed suddenly, and then we did a lot of tests and finally had diagnosed him with the transverse myelitis. But the cerebrospinal fluid culture, uh, neither culture nor PCR did not show any major microbial cause of this condition. So it stayed a mystery, but he was fortunate enough that with the appropriate treatment, he regained his abilities to walk again. It was a slow process, but still fortunate that he regained his ability to walk again. And it was very nice. It's very nice to see after such a uh, devastating like condition see him to um, come back, regain his abilities, and be happy again, be healthy again.
Absolutely, it definitely
Very,
feels.
very, very interesting cases are a lot, especially with genetic. With pediatrics, we deal with a lot of genetic conditions. We had a condition of severe case of a severe combined immunodeficiency once. And there are lots of weird cases. Like weird cases mostly goes with when little kids try to stack some things in their nose, in their ears, some very, very weird things like lots of magnets, swallowing lots of magnets and thinking that it could be appendicitis or some kind of obstruction. And then you find out that there are 19 magnets swallowed by the kids. So it's kind of also amazing, also very scary what the kids can do sometimes and how dangerous they can be to themselves.
Absolutely, it's a mix of feelings at the same time.
I agree, yes, yes.
And actually, this mystery of medical science, where there are so many complexities and sophistications. So this is what also led me to choose medicine as my higher studies. I've always loved the fascination, and I've always had the fascination to learn more about my own body and also to treat people.
Absolutely, I agree. Like, I loved learning about my own body also because it's amazing to know how it works.
Yes,
Uh, every inch of your body and every centimeter of your body, you know about and how it deals with different processes. That's amazing to know about. And the mysteries that you solve, the cases, I think that's the most exciting part, like being the mystery solver. But I have to say that there are a lot of routine cases in medicine that you have to deal with every day. But mystery cases are most amazing and interesting to solve and work with, to me at least.
Yes, I agree with you, definitely. Now, since you have such a busy schedule with the Winnaviter clinic and lectures also at our university, and
Hmm.
also how do you find the balance between all of it? Like you go to clinic, then you come to, for our lectures, and then also you pursue ballet. So how do you balance it?
I agree. A lot of people ask me that. Like probably 90% of people who know me also have the same question. Like, how do you balance? How do you manage those things? But first of all, it's all about the will, and then you have to have a certain amount of health. Obviously, have a certain ability to do that. But I have to say that, for example, the ballet, which I dance the Georgian national dances, the Georgian National Ballet, and it is the exercise for me that it keeps me healthy and more energetic, even though my muscles get tired when I'm there. Uh, it still keeps me more energetic, and it still gives me the health to deal with all this, like busy schedule, getting up early morning, not sleeping enough. Exercise is something that gives you energy, gives you health, and also gives you happiness, decreases your stress level. Because I've tried to be without exercise because of my busy schedule. I said that, okay, I don't have time to dance anymore. I don't have time to do ballet. But then the stress level rises up so much that, you know, and you feel lack of energy, you feel like lack of happiness. So, whatever you do, still like, it still fits in the schedule the same way. Like in reality, this exercise keeps you so happy, decreases your stress level so much that you can do more. You can manage more.
Indeed, I agree with you.
So
I've always seen.
that's my secret. That's my secret. Like when you love exercising, you exercise and you keep energy high.
Absolutely, I've always seen you so happy and energetic. Like no matter what time is it. Sometimes I've even seen you with headache, but still you have so much energy in your body that yes, I can do it. I will do it. It's actually very motivating for us.
Uh, I agree, especially like when you are after a night shift and you go to the uh, lecture and you do a seminar in front of the students. Um, you might have a headache, and I sometimes expect that. But I'm ready with a, painkiller medication. That's for one, and then you just have to have a will. And then also, like when I'm with students or when I'm with patients, I know that I have to be as positive as possible because students need me there to explain some material, make it easier for them to understand, practice a little bit more, also enjoy, have some fun, and patients also need the same. And uh, I guess the ballet, I need ballet for all this to keep myself more positive,
More positive.
positively at a positive level.
That's amazing to know. Also, is there any achievement that you want to share with me and also the audience hearing you? in ballet specifically?
In ballet, we've been before I dance where I dance right now. It's just in the Georgian National Ballet, but I'm not in the main group because I have the other profession, which is medicine. So, uh, I was a dancer at the Tbilisi State Medical University. So we basically traveled all over the Europe, and also we traveled in the USA. But in the Europe, we got some very good prizes. Like we got our group usually we're not I'm not an individual dancer. We were always the group of dancers, the ensemble that we called it. Um, and I remember in the Czech Republic, for example, we got the first place in the international festival of folk dances, and it was really amazing because then at the end of the concert, it was voted by people, so they voted their favorite, and turns out we became their favorite. And at the end of the concert, we did the one of the Georgian folk songs. But the thing is, these people from Czech Republic, they knew that Georgian song and they were singing with us, and it was an amazing feeling, like very, very emotional. Plus, if we consider that they came there and stayed there in the rain, they were ready with umbrellas and raincoats, still ready to watch, and they wanted to watch our concert so much, and it was an amazing feeling, like to be appreciated that much and to be present at stage and dance for them. It was an honor, really. I
Yes.
remember it very nicely.
Yes. That actually makes me so happy and proud to know you as a teacher who has done so much and achieved so much in the past as well. And
Thank you very much. Makes me happy to hear that.
you're welcome, definitely. Is there any achievements in your medical field that you want to share with the people?
Any achievements in the medical world? Well, I would not say that in medical field it is really hard to be alone and to say that you achieved this thing alone. Because I am a recently licensed pediatrician, I have to say. Before that, I was the pediatric resident, and only recently I got my medical license. Therefore, whatever we have done as a group, I have to say. Um, and I've been a team member of an amazing pediatric group at where I work. I work at two hospitals, and both teams are amazing at taking care of the patients. So we have done a lot of amazing works together, and I am very happy that I am the team member of such amazing team. But individually, I would not be so arrogant to say that I was the one that achieved something amazing. I still believe that it is all ahead of me, because medical practice is something that, you know, few years in medical practice, I don't think that's enough. Like for medical practice, you would need a lot of years of experience to do some good, to do some real good. But I also believe that every patient that trusts you and every patient that becomes healthier, that becomes better, feels better because of you is also an achievement. That is what makes me happy. Like when I learn that they are better, when I learn that they feel better, their case is solved, their mysterious uh, and
Uncovered,
like
uncovered.
revealed, and we know the diagnosis uncovered, yes, and we can treat them and they become better. That's an achievement already. So I
Amazing.
think it's the best part of medicine.
Yes, when a stranger comes in the clinic, you don't know the person at all, and he trusts your advice and he becomes better. I mean, that's like a superhero thing.
Yes, kind of. I love when they show their trust, and I also love when I uh, respond them so that their trust is met, their needs are met properly.
Absolutely. And since we are in this conversation about medicine and patients, so is there any tips that you want to share with the people, especially the parents who need to take care of their infants the right way? Any tips?
Um, yeah, first of all, every parent needs to have a pediatrician for their baby to keep in touch with them and give them the correct information. Pediatric age groups vary a lot, so that in the first year, for example, it's very important to pay attention to the baby's growth and feeding schedule, feeding time. So, uh, the some of the important things would be like to pay attention to their growing schedule, weight gain, and also um, everybody probably knows, I don't need to say that anymore, but breastfeeding the babies is the major benefit for them, especially until uh, 1 year of age, and especially until 6 months of age, that is crucial. And then every new food is going to be introduced and should be introduced little by little at the proper time, obviously. And at the later ages, more common things that the children are affected by is trauma, for example. So we need to be careful uh, with that, and we need to monitor our kids more like intensively. And also, I would, based on the clinical practice, the cases that we've seen, I would advise them to keep the dangerous things unreachable for the kids at places where kids can't reach them. And maybe it can be like cleansing materials, cleansing powders, or drugs of any sort, and also sharp objects, like everything like that. Kids can find trouble everywhere they can reach, so that they should be kept away from the kids' rigid places. Mm. And also, obviously, parents need to find a doctor that they trust. I strongly recommend that if you don't trust your doctor fully, you have to find someone else to trust them. Because this also frequently happens that they trust their doctors only partially and only partially follow their advice. And that does not usually result with the best outcome, and that it's for the benefit of the kid to trust your pediatricians uh, as much as you can and find someone who you trust the most. Also, like with the drugs, if you do not need a drug, do not absolutely need a drug, do not overdo it. Do not over medicate your kids, especially without your doctor's recommendation. That would be primary advice, probably, and most important that I could share.
Yes. Since you mentioned some of the very common, things that people should know and they know, but they are not following it. So taking the right advice is very important, and also be in constant touch with the pediatrician of their choice. And what would you say, like some of the lesser known facts about pediatrics, that these are like the hidden gems that people do not know, but maybe it's time they know about the secrets of pediatricians.
Uh, okay, so well, one of the things, like one of the common mistakes, was it your question? Like a mistake that we've seen,
Mistakes are
is that
lesser known things.
mistakes or lesser known things? Okay. Yep. Some of the lesser known things are that, for example, the babies, infants, while they're breastfeeding, they don't need water. They don't. They don't need to drink water. They will not become dehydrated because they drink the mother's milk. They consume breast milk. Also, you have to know that your baby must grow every day, okay? When they are infants, especially at an early age, early infancy, first few months, they must grow every day. But still, you do not weigh them every day. You weigh them like every month, for example. And based on each of the, based on the age, this weight gain should be different and should be appropriate. But it would be very detailed uh, right now, detailed talk. But your pediatrician will provide this information if you ask about. Also, we mentioned that several things are not advised in the first year. For example, like honey, even though it is a very good product, a very beneficial product for older people, for adults, and older children. It is not advised in the first year of life, especially because of the allergy concerns and also because of the infant botulism concerns. Also, uh, some of the vaccinations are also very important that we know. Routine vaccinations. Uh, some people are more hesitant. Some people are, actively vaccinating. You need to talk to your doctor about this. The decision is always upon by a parent, but they need to understand the concerns, the benefits, and the risks of each of this, and decide upon this. And also, one of the things that should be probably mentioned that there are some symptoms in pediatrics that for example, a cough, specific symptoms. For example, a cough. There are lots of different types of cough which the parents might not know, and there are also lots of different medications for cough that we can use for different types of cough. But I've seen cases where parents try to use their own cough medication for their kids, especially for their young kids, which is very dangerous because some of the medications should not, should never be used in a very young kid. There is a reason behind it. There are many different types of coughs, as we said. There is the dry cough, there is the productive cough with sputum, the cough that is caused by the upper respiratory tract infections, lower respiratory tract infections, bronchospasm, pneumonia. So all of these medical conditions need different type of treatment. So the common mistakes and common misconceptions that we have seen is that parents using uh, without the doctor's recommendation, parents are using the cough medication that was prescribed probably for them or for their older kids, and they are using it for their younger kids. So, general overall recommendation would be never use a medication without the doctor's recommendation because it can have a specific age, appropriate age usage, or it can have specific restrictions, age specific restrictions, or it can have specific condition specific restrictions. Okay, Mm. Therefore, there are some very common misconception and mistakes that we see usually, which can cause complications of these conditions in children.
Yes, absolutely. Using the different medication for something which is not meant for the baby can be very detrimental.
Yes, absolutely. Um, Especially like the specifics, there's some medications are mucolytic, they are uh, going to like start like induce more coughing in the baby, but the babies cannot cough up so much. So all these productive mucus can go into the lower respiratory tract and can cause the complication of this infection with the lower respiratory tract infections. So using them at the specific out, outside of the specific age groups is a mistake, and we should not do it without the doctor's recommendation.
Absolutely. And since we have covered some general health tips as well as the misconceptions, now I want to also address the students listening to us. So, is there any tips that you have for the students listening to us in the medical field who will soon be graduating and be, going out in the medical clinical field?
Um, yeah, okay. First of all, never stop learning. That would be a very first advice. Sometimes some people, some students, some I don't know, might assume that they are done with learning once they are done with the university. But that's a very wrong idea. You are going to learn more and more and more. So every time you see a real patient with the real condition, you need to review that condition, review the physiologic mechanism, and review the treatment options. And you need to put several things in the differential, what this could be. So once you start seeing the patient, start guessing because first of all, once you start medical practice, um, you will not be alone. You will be with some more experienced doctors. But start guessing yourself. Are you diagnosing them correctly? Compare your diagnosis, compare your diagnostic test choices, compare your treatment choices to the treatment plan that will be decided later by the experienced doctors. So test yourself all the way every day. And also, I would advise that uh, be empathetic to the patient. Like, imagine that it is your family member in the place of them, in their place, because it gives you more empathy and it helps you to see their emotions better. That will make you a better doctor, and patients will trust you more in that case if you see them emotionally and if you try to connect with them emotionally, ask for their name, maybe try to connect with them with some questions a little bit, uh, and introduce yourself and try to connect with them, see them as people and not just as cases. Uh, like mm, it's wonderful to have a mystery in front of you and solve the mystery and uncover it. But once you see them as people, that's a whole different experience that you get and they also get while being treated by you.
Yes, the connection is so very important between the doctor and the patient. And I've seen patients feel good the moment they have seen that now I have a connection and now I trust you. And they get such a good relief that they are in safe hands.
Yes, I've seen a lot of patients with in my student years, for example. Some of them really love their doctors and they fully trust them. And when a patient comes to the clinic, comes to the hospital, and they don't know the environment, they don't know the doctor, they don't know anybody around them. It's hard for them to trust, and it's also hard for them emotionally to be in the stressful situations with people that they don't know. And when you try to connect with them, they start to trust you more, and it builds a better doctor-patient relationship that you know it helps you to. They are more um, as they trust you more, they are more likely to uh, do as you say and follow your instructions.
Absolutely. And there is only one last question I want to ask you because I know you have a very busy schedule as well. So let's suppose that you had the chance to leave behind one thing that you learned or you discovered on your own, and if you had the chance to leave it back in this world, what would it be?
That's a difficult one. It's a difficult question. Um, I would um, I would definitely leave behind my name as of doctors who is very empathetic to the patient and also who is very trustworthy and reliable. I want to be someone who can solve the mysteries that others cannot. And starting from now already, I've I've guessed some mysteries that others couldn't. So I want to like work on that more. So be someone that patients can be referred to when the other doctors probably could not fully solve the mystery. So there's something nice feeling, when they come to you and you can help them. Um, okay. Um, and probably a little bit later, I would also uh, wanna write about my doctor patients and some interesting experience in the medical practice. I may have started already writing about this, so probably after the experience there will be a lot of writing, a lot of written notes that will come out as a book. So hopefully that will also kind of be left behind. Um, and I want people to know me by my name, recognize me as my name as someone to be very trustworthy and very reliable for them and very loving. So I think that's it.
Yes, and you actually are very memorable, and I still remember my first class with you, and you showed us a presentation. It was 13 ways to kill your patient, and you showed us all the mistakes to not do with your patients.
Yes, that is a very intriguing presentation that I sometimes present to my students in the first class to kind of give them a shock of like how you can kill a patient with the lack of your knowledge.
Yes.
So yeah, if you don't know this, this is the way to kill your patient. If you don't know that, that's also a way to kill your patient because if some very important and crucial knowledges are lacking, there is just one step. Danger is just one step away. So students, when they are starting learning, starting to study study medicine, they need to realize how much detailed knowledge is important to actually make your patient live and not kill them. Because very important details could be very, very little details could be very important and very decisive between patient's life and death. So students need to realize how serious this path is and how serious they need to be about learning the details. Uh, you know, for example, there was like drug-drug interactions there. Um, when you're prescribing a medication, you need to be very careful about the other medications the patient is taking. And there are lots of cases that you need to know about the patient's previous medical history, about their other conditions, because by missing them, you could create a potential risk for their life. So
Yes,
I guess that's a memorable presentation for a lot of my students. So I should continue to present it to my other students when they first come into my class.
for sure, for sure. And that actually brings us to the end of our interview with you. It was a great session. I love talking to you about your pediatric experiences as a lecturer and also as a great ballet dancer. Thank you so much for taking the time to come on the show of Medico Memoirs. Thank you so much.
Thank you again so much for inviting me here, and I hope it will start off very well, very nicely. I am sure that you are going to be a successful doctor in future, and I hope that I will see your podcast with a great success as well.
Yes, thank you so much.
Have a good day.
Yes, you too. And that concludes another episode of Medico Memoirs. A huge thank you to our fantastic guest, Bela Nishnianidze, for sharing her amazing insights and experiences. If you enjoyed today's episode, make sure to subscribe, leave a review, and also share it with your friends and fellow colleagues. Remember, we are here to empower your health journey, bridge knowledge gaps, and also promote health equity. Until next time, this is Jabirul signing off from Medico Memoirs. Take care and be safe.